Chicago Abortion Fund. Visit us on the web, chicagooabortionfund.com, or you can be our friend on MySpace, www.myspace.com. And the phone number is 312-663-0338. And we have another question. Do you feel that there are any ways people can help speed up the funding for rape counseling and rape kits?
Well, as far as counseling goes, RVA as a whole is nonprofit, so we definitely rely on, donations and funding and that sort of thing. So any and all donations are always welcome. As far as for the survivors having to pay out of pocket for counseling, many rape crisis centers offer free counseling for survivors. RVA is one of those, so a survivor would not need to pay for counseling if they came to us for counseling. There is a way to speed up the funding for rape kits. There's actually something that I just learned about yesterday called the Debbie Smith Fund. And they go and lobby for money to help in speeding up the process of getting the rape kits. So as far as the processing of rape kits, that's something that Illinois State Police does, or the Illinois Forensic Crime Labs. So whatever government funding, assists them would be who we would target to kind of allocate more money to getting them sped up.
Okay. Wow. So much information. I'm just learning so much today. Well, how do you feel about the reproductive justice movement?
RVA is totally in line with it. Like I said before, we really want to make sure that our survivors have options and access to those options. So reproductive health is definitely affected by assault. So anything that can maximize resources, access to services, making sure survivors have options is something we are completely behind. So
that's good to hear. So, once again, I was going to put our information up because I think it's very important that everyone knows it. So, okay, Chicago Abortion Fund. You can contact us 312-663-0338, and we are www.chicagooabortionfund.com on the web, and you can befriend us on MySpace, www.myspace.com. So, Sarah, how long have you worked for the Rape Victims Advocate?
I've been there a little over a year now. And I love the work. I love being there. It's really important work, helping these women, know that they have choices, empower them, making sure that they're not lost in the system, that they have someone to speak for them when, they may be too scared or unwilling to speak up for themselves. So I love it, and being a part of, going out there in the community and educating people or training, law officials or, state's attorneys, or going into hospitals and, giving them professional training on how to better treat survivors is, a great opportunity as well, because those are the institutions where they really, need to know how to address some of the issues that come up with survivors. So.
Right, definitely. Wow, I've learned so much today from Sarah. Jeez, sounds like a really, really great program. So your services are like tremendous to the community, and I wanted to know how can just a regular normal person like me go about donating, helping, getting involved,
Well, I'm happy you asked that. RVA, a huge part of our advocacy program and the medical advocacy that we provide in Chicagoland area hospitals is done by volunteers. So we're always looking for volunteers to help us with medical advocacy and coverage in our emergency rooms with responding to emergency calls when survivors go into the hospital. Another part of that is that volunteers can also come out into the community with us and do public education and prevention. So, we're always looking for people that, want to do one or both or the other. We actually have a training coming up for volunteers this June. That's a 40-hour training. And the orientation dates are actually May 18th and 19th, I believe. So if there are any callers that are interested, or anybody watching that is interested, please contact RVA to find out more about those volunteer opportunities.
And you said the May 18th?
I believe it's May 18th and 19th is the orientation. But I do know that the training's taking place in June. So
okay. Sounds good. We have a caller.
Hello.
Hi, caller.
Hi. Thank you very much for taking my call.
Sure.
I had a question about the volunteering. In what areas or in what capacity do people volunteer? Like, do you have to be trained or a specialist? Will you actually be working with victims or survivors, or there are some other capacities in which you would be allowed to help?
Well, as far as if you would already, have to be a professional in the field or not, you do not. We get anybody from, the county clerk's office wanting to volunteer, to nurses, to doctors, to college students. So it's really open to people, from all walks of life to come in and volunteer. In order to volunteer, you do have to complete the 40-hour training. And then at that point, you can decide whether you would want to volunteer for advocacy services, which would be providing medical advocacy coverage to our 13 Chicago area hospitals. They're 12-hour shifts, so if anybody were to present in the emergency room as a survivor, they would page you out and you would come in and give them emotional support, as well as running down what options they have. If medical advocacy maybe wasn't something that you were interested in, the other area that you could volunteer in would be our education and training, and that would be our public education and outreach and prevention.
We have another caller.
I'm talking as a father. Do you think there should be much more in terms of better law enforcement, in terms of neighborhood being notified when you have a convicted sex offender in the neighborhood? Because I noticed that when I look on the internet, I thought we had a law when you have a sex offender come in the neighborhood, they got to go door to door, let you know that you have a registered sex offender in the neighborhood.
Right. Now you're saying that the neighborhood needs to go door to door to let you know?
Hello?
Yeah,
I'm talking about when you have a registered sex offender, okay?
Right.
I thought they supposed to go door to door. I'm talking about the registered sex offender had to go around in the neighborhood, let you know that he's in your neighborhood.
From my understanding of the sex offender registry, I believe that the obligation is on the sex offender due to privacy issues with the registry. Like, it is online, you can access it online, but as far as the Chicago police kind of sending something out to the neighborhoods, I would believe that they probably don't do that because of privacy issues. However, I do think that it's important that people do access the website and see what offenders do live in their area. I wish there was a better way to make people more aware of that, but there is a responsibility, to ourselves and to our communities to look up that information. That's why it's posted online. So that way you can keep your children safe and, your neighbors safe and even yourself safe if there is somebody in the neighborhood.
Oh, okay. So, wow. Once again, I just wanted to put our overhead so you can know our information. Okay. 312-663-0338. The Chicago